Welcome to June 2023. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. Lots of great content this month with a focus on what questions. What about having a primary PICU team for complex long-stay patients? The first study comes from Madrigal et al. It's a survey from Pediatric Critical Care Fellowship programs covering 72 states in the United States, and there's an accompanying editorial. The second study is what should we know about and do about pulse oximetry and race. This comes from Savognan et al., and many of you will be familiar with the data from adult COVID patients and race. The United States FDA had a special safety communication and meeting in November 2022 to discuss this issue, and a bulletin was put out to all in the field. Now we have a report of over 2,700 patients, all with COVID-19, 61% Black, and the authors have looked at the bias between SpO2 and SaO2. In my view, I think this is the most important paper we have had for a long time. There are many issues related to this. Many authors, as they submit work, I often ask them to address this question when they look at SaO2 and SpO2. Do read. And then finally, what can we learn about electrophysiologic monitoring of tonic diaphragmatic activity during expiration as part of breathing? This comes from Plant et al. We've had a number of articles about the diaphragm, and this adds to this literature. The authors have looked at 200 intubated patients, 222 other patients with NIV, and a focus on bronchiolitis. And there's an editorial on the whole question of work of breathing. In the PCCM connections section, I focused on severe illness in resource-limited settings. We have a special article from the SCCM Pediatric Sepsis Definition Taskforce. I give you a little review about articles that we've had from Kenya, South Africa, and Malawi. And now this month, we have a report from the first PICU in Malawi, 28% mortality. Worth reading to explore their experience. And finally, there's a narrative, PCCM narrative called She Wept. Looking forward to seeing you next month. Thank you for your support to all our authors and reviewers. Good day.